Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Friday, March 19th, and this is our COVID briefing. First, I just want to apologize for the late briefing this week. There have been a lot of new changes that have been happening and new recommendations that have come out this week, so we have a lot to cover today. We've had 8,521 cumulative positive cases in Missoula County to date, with 30 new cases since yesterday. We are continuing to see those larger case numbers coming in that we started to see around the middle to the end of last week. We've had 88 deaths associated with COVID-19 to date, and we currently have 145 active COVID-19 cases, with 5 Missoula County residents hospitalized and 1 out-of-county resident hospitalized in Missoula County currently. And our average incidence per 100,000 people is holding at 16 right now. The state of Montana is reporting 102,768 cumulative positive COVID cases, which is up 157 new cases since yesterday. There are now 1,033 active cases with 51 hospitalizations across the state. And there have been 1,409 deaths related to COVID-19 statewide. The University of Montana has had 686 cumulative UM-associated cases since the beginning of fall semester back in August, with no new cases reported since yesterday, and there are currently 8 active UM-associated cases. To date, there have been 44,337 doses of COVID vaccine administered in Missoula County, with 17,063 people having received both the first and second dose of the vaccine. Today, I'm going to talk about moving forward into vaccine availability, moving into phase 2 for vaccine delivery, variants of COVID-19, new recommendations from the CDC for physical distancing in schools, and the new recommendations for events and gatherings that were adopted by the Board of Health yesterday. So due to the federal allocation of vaccine to Partnership Health Center and various pharmacies around Missoula County this week, we've seen a large increase in the amount of COVID vaccine that's available. This is allowing more access to vaccine for those who want it. We are still currently vaccinating those who fall into the 1B category, and will be opening to additional groups in 1C over the next couple of weeks. We will also be opening up to phase 2 on April 1st with the rest of the state. Please continue to check covid19.missoula.co for available clinics for vaccine. Also, I just want to let everyone know that when we first started opening up the clinics, the appointments were going really fast, like within the first 5 to 10 minutes. That's no longer the case. So if you would like to get an appointment, just know that right now you can still get an appointment even if it's several hours after a clinic has been announced. So again, you just need to check covid19.missoula.co for a list of available clinics where you can get an appointment. So next, I want to talk a little bit about why it's so important to get vaccinated when you have the chance. Getting vaccinated not only helps you, but it helps other vulnerable people who can't get the vaccine yet. For example, children under the age of 16 cannot get the vaccine, but some children do have immune deficiency issues that could make them more susceptible to COVID-19. So by getting vaccinated, you're helping build the herd immunity that our community needs to protect everyone. If enough people get vaccinated, we won't have to worry as much about spikes and large outbreaks down the road. If not enough people get vaccinated, it's a very real possibility that we'll continue to have large COVID-19 outbreaks as time goes on. So we want to thank everyone who has gotten the vaccine while they're eligible. So next, I want to talk a little bit about variants. In the past week, DPHHS, the State Health Department, has identified 21 variant cases of COVID-19 throughout the state of Montana. There have not yet been any variants identified in Missoula County, but we do believe it's just a matter of time, and we'll begin to see variants here as well. We just want to remind everyone that it's important not to let your guard down and to continue to practice prevention measures. Experts warn that the more contagious, deadlier UK variant could become the dominant variant in our nation by the end of April if people don't take precautions. The former acting director of the CDC, Dr. Richard Besser, says that we need to hang in there with masks and social distancing until most adults have had the chance to get vaccinated if we want to avoid another deadly spike. Today, the CDC updated its recommendations for physical distancing in schools and childcare settings. The new guidance recommends 3 feet of physical distancing in those settings rather than the 6 feet of distancing. The reason for that change in guidance is based on several studies that have been conducted both internationally and here in the United States. These studies indicate that in a structured setting like schools, transmission rates of COVID-19 remain low in children, even when they're spaced at 3 feet rather than at 6 feet. They still recommend 6 feet of distance between adults in these settings, and they still recommend that other mitigation measures remain in place, such as wearing a mask, frequent hand washing, and screening for symptoms. Last, I want to talk about the new recommendations adopted by the Board of Health yesterday at their regularly scheduled monthly meeting. We know that people are trying to plan for events and gatherings for later this spring, summer, and even next fall. While this entire pandemic for the last year has been and still continues to be unpredictable, we want to at least establish some guidance for allowing large events and gatherings to occur if we reach certain milestones. Much like we recommended lifting some restrictions after our incidence rate stayed below 25 for more than 2 weeks, the guidelines that have been adopted by the Board of Health are called Alternate Appendix A to the current restrictions for COVID mitigation. If the vaccine dose administration rate is at least 600 doses per 100,000 Missoula County residents age 16 and older, and the new case incidence rate based on a 7-day rolling average has not trended above 25 per 100,000 population for the previous 14 days, then the alternate Appendix A goes into effect. These stats will be examined by the health officer every week on Tuesday, and an announcement will be made public when we reach those milestones. Under the alternative Appendix A, masks will still be a requirement for all events and gatherings, but it removes the cap on the number of people who can attend an event and provides COVID mitigation guidance for event planners. Under this appendix, only events with more than 1,000 people will need to consult with the health department staff regarding their event plan and mitigation strategies. So I know that was a lot to cover. That's it for today. As always, you can subscribe on YouTube under my name, Cindy Farr. That's CindyFarr. Click the notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can call 258-INFO if you need assistance in scheduling a vaccine appointment, or if you would like to schedule a test for COVID-19. And as always, please check our website for lots of great information at missoulainfo.com. Everyone have a great weekend, and I will talk to you again next week.